Hi everybody, I'm Dr. Kia Mitchell with Limitlessmewellness, and I am hopping on real quick to answer some of our frequently asked questions regarding semaglutide. I will jump right in. Probably the most common question that I get asked is about side effects. And side effects vary. I have patients who tell me I have no side effects whatsoever. I don't even feel like I'm taking any medication. All that I notice is that my appetite is decreased. I have patients that tell me that, all the way up to patients who get all of the most common symptoms. And the most common symptoms with taking semaglutide are going to be nausea, a headache, constipation or diarrhea, some stomach discomfort, which may look different to different people. Some people will tell me that it feels like it's just unsettled. Some people will tell me that there's some pain. Some people will not be able to quantify what they experience with the medication itself. And then I have patients who tell me that they're very, very tired. There are some other side effects that can happen, and those are mostly related to the injection site, whether it's itchy or there's some swelling or a little pink. But usually nothing should be coming out of the injection site. There shouldn't be any pus coming out. It shouldn't feel hot when you touch it. It shouldn't be painful, just, a little irritation there. So those are the most common things that people will tell me. I would say another very common question is about the fatigue that happens with semaglutide or tirzepatide. I think that most of the time when it comes to the tiredness, patients really are not eating enough. I know that sounds crazy because that's what we're using these medications for, and that should be one of the goals of us using the medication. However, your body needs enough calories to just run. And if you're not eating enough calories, you have to be very careful. Secondly, I think sometimes people are not hydrating enough. They're not drinking enough water. They're not fueling their body like they should. And so it does make it feel very difficult to actually stay on the medication. You can get very, very tired. And so ways that you can combat that, honestly, I would say the most important piece is to make sure that you eat your protein. I would say, if you have a plate of food, I'd eat your protein first and your carbs, then, jump right in with your fats and your fiber and your grains and all of that. But, you really have to be protein heavy and protein rich. And make sure that you are getting your rest, you're still exercising and doing all the things that are foundationally important with these medications. Often I get asked when it comes to tirzepatide and semaglutide, what is a good way of using these medicines? And in order to use these medicines effectively, I think that you should not use these as a quick weight loss tool. Many patients will come in telling me, I just want to lose a few pounds before my family reunion, my class reunion, homecoming dance, a Christmas party, something that is an event coming up. I would say, in my opinion, these medications are going to be effective with the foundation of diet and exercise as your key component. However, they do help in patients that have been struggling with weight. And so if we're using these medications to become a healthier version of yourself, whether it's to get off of medication for blood pressure, off of medication for diabetes, see about an alternative when it comes to your cholesterol, or see if there's something that can be done honestly with just this stubborn fat area. Sometimes you just want to look a different way. That's fine, but it's gotta be because you wanna be healthy and not because you want a quick fix. The last thing that I'll say regarding the medications semaglutide and tirzepatide, which are the active ingredients of Wegovy, Ozempic, Mounjaro, and Zepbound, is that you can become a healthier version of yourself. It is extremely important, though, that you know there are always going to be fads, whether it's I lost weight with Weight Watchers, or I lost weight with Jenny Craig, or the Atkins diet, any keto alternative, South Beach diet, whatever. I have patients that come in telling me that they've tried it all and this is a last resort. The thing to me is to know that the pictures that you see on the internet where patients are losing 30 pounds in 1 month are not realistic. Often those patients have taken photos that were 10 years apart, and you can't even tell because you wouldn't know, but it took them 10 years to lose 40 pounds. So sometimes what you see on the internet isn't necessarily what you get. If we want to take these medicines and get the weight off and keep it off, historically, we recommend that you lose 1, maybe 2 or 3 pounds a week at a maximum, because anything more than that, it's not usually going to be sustained weight loss. So really think about your reason for doing this, and really think about the fact that if you want to keep it off, slow and steady wins the race. Okay, guys, if you have any questions, feel free to come in for a consultation at 904-204-WELL. That's 904-204-9355 at Limitless Wellness. See you soon.